Well, all right, everybody. Good evening. I am going to call to order this meeting of the Dunn County Health and Human Services Board for Thursday, May 25th. Although it is not really easy for me to see who is all in the room, it looks like Supervisors Morehouse, Breslin, Hagan, Robinson, and Steen are present, if I'm not mistaken. And it looks like Dr. Hall, Mr. Lamb, and Ms. Rudy are present, meaning everyone is here. Thank you all. Thank you all. Ms. Winter, if you don't mind, I will call on you to introduce the B3 team, and welcome to you all. Thank you for being here.
Thank you. So we will have the Bertha 3 team introduce themselves and talk about their roles a little bit and what they do. I'm grateful that they're here with us tonight. This is part of the team, not all of the team. So I'm going to have them pass the microphone and do that. But I do want to first recognize Dale, our Bertha 3 team leader, who has supervised this unit since she started, I believe, right? Yep. So, and she is retiring on June 2nd. So tonight we are celebrating her as well as the team, and just wanted to make sure that people were aware of that. And not only the Bertha 3 team supervisor, she's also the deputy director. So thank you for your years of service, Dale. I appreciate that.
Hello, can you hear me okay?
Yes.
Okay. I'm Amanda Hansen. I am one of 2 teacher/service coordinators for the Bertha 3 team.
And I'm Vicki Evansberger. I'm the speech therapist in the Bertha 3 program. And everybody considered me really old today when they announced I've been at the county for 28 years.
We appreciate it, Vicki.
I am Rochelle Craning. I am considered the grant coordinator, and I am coordinating the Bertha 3 playgroup.
I'm Dale Tickler, currently the supervisor of the Bertha 3 program and deputy director.
Hi, I'm Becky Albright. I will be the new deputy director and taking over for Dale.
That is the team.
All right. And thank you very much. And thank you for all the work that you do, and we'll look forward to hearing from you in just a few minutes. We have meeting minutes from April 27th. I will entertain a motion. Supervisor Steen moves. Is there a second? Supervisor Hagan, any additions or corrections to the minutes from April 27th? Additions or corrections? If not, all in favor of approving these minutes, please say aye.
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 Any opposed? The minutes from April 27th are approved. Is there any public comment, Ms. Winter or Cassie?
I've not received any.
All right, there is no public comment. Our next meeting date is a regular scheduled June 22nd meeting. Any problems from anybody with that date? All right, hearing none. If not, we will move forward. And I'm really delighted to have the Bertha 3 group here. I don't know how you want to plan your presentation, but we are happy to have you, and we are all ears.
Oh, super. So could you hand these out maybe? We have a couple handouts that we brought today. One is a visual of what Bertha 3 process is, from the initial referral onto transitioning out of our program into perhaps the school district or different therapies, or just graduating with flying colors. Our team consists of 2 teacher and service coordinators. We have Vicki, our speech therapist. She's with the county. We also have an occupational therapist and a physical therapist that we work with through Prevea. We have a contract with them. So everyone can see their little visual. So our initial referrals, we get referrals mainly from physicians during those well child checks, but anyone can refer. We take phone calls from family members, daycares, Head Starts. Usually, after that initial phone call, Natalie or I will contact the family, talk about their concerns, and then we figure out who the evaluation team should be if they decide to go forward with the evaluation.
So in order to qualify for birth to 3 services, a child has to have a diagnosed condition. Otherwise, they have to be about 25% delayed. And that's kind of a team decision too. We ask the parents a lot of questions. We go into daycares, different community settings, ask grandparents kind of how the child is functioning and if there is a need that we should develop a plan. So, and we set those goals for kids for like 6 months, and then we review that as a team to see how they're doing.
So a lot of our kiddos that we get are little speech delayed boys. Right, Vicki? We keep Vicki very busy. But we see children with a variety of syndromes and other disabilities from prematurity to maybe feeding difficulties. We get, and social emotional, we're getting a lot more social emotional since COVID, which kind of leads into our need for this play group that we applied for this grant. But as you look through this visual to how we deliver services, we find that families work well if there's one main provider. So we do a primary coach approach with families, and we're there to help support and give ideas of what they can do during their day within their routines to help their child develop. And I guess we can go on to transition. You want to talk about transition? Okay.
So, okay, some kids exit our program and reach their goals before age 3. And some children go on to different community settings. So one common would be the school district, and Polly knows about that, where they might continue with early childhood or just speech therapy services. The requirements are a little different, the school versus some of the clinics, like foundations therapy is common in Menominee or Mayo. So some kids might get therapy there if they want to qualify for the school. We have a lot of communication with Head Start with kids that go on to that program or that are duly enrolled with in early Head Start and birth to 3. So that all needs to be in place by the time a child is 3. So, and I was just going to add too, you know, we, as a team, we do a lot of work with the different school districts, with doctors. We communicate with child protection about some kids. You know, we go in homes and the heat's going to be turned off the next day and the family's in crisis. So we're communicating with people, economic support or people at Human Services. They have a toothache, but nobody will take them because they don't have any insurance. I mean, we see so many things. I'm a speech therapist, but sometimes that's the last thing that the parent is concerned about if they're in some sort of crisis. So, I mean, we do a lot of networking throughout the community. Housing is a big thing. So you get to know a lot of people in this job. So,
yeah, we serve typically in the high 50s, low 60s, and we serve the whole community. So we're on the road a lot. But going on to our grant that is my 5 minutes up.
How many referrals do we get in a year? Do you know that?
I think we get close to 120, maybe more. Why do you ask me that? I didn't look that up.
Just think of it.
But I think we're usually like, 10 to 12 referrals a month,
Yeah.
typically.
Yeah, actually, and I just looked, I was with Carrie today, and this year, most months have been about 14 referrals. So,
Yeah, we've been busy.
okay, we'll move on to Rochelle.
I just wanted to say a couple of things about this team. It's been a pleasure to work with the Birth of Three team, and they're very modest and humble. The Birth of Three program is a federally mandated program. It's evidence-based. It's shown to keep kids out of more severe situations in many cases. And sometimes these kiddos are served at these young ages and then don't need other services in the school. So they do some amazing work. About a year ago, we had an opportunity to write a grant through the state. They had some leftover ARPA money or some additional ARPA money from COVID, and we wrote a grant. The purpose of the grant had to be to support the social emotional needs of children that had been isolated during the pandemic. So we wrote a grant, and part of it was to hire Rochelle as the program grant coordinator and to do a play group. And I'll let Rochelle go into that, but it's just turned into much more than we had anticipated and has really grown and become just this unique community and really heartwarming.
Thank you, Dale.
Thank you.
I have a poster that we made up just with some photos, so you have a little visual of what we've been doing. And we have actually been in the room right next door, room 60. And so I tear down the tables and chairs Thursday night or early Friday morning. And I set up this environment to welcome young children and their adults that come in. And when we've served, well, weekly, we get about 40 families that are coming through the door. We were doing one play group and saw the need to do something because we couldn't fit everybody in that space. So we are now doing 2 play groups every Friday morning. And on June 6th, we are adding an evening play group because I have had so many people say we need to be a part of that, and we're working during the day, or we have other things going on during the day. And so we are renting the play space downtown Menominee for a Tuesday evening group that will be starting up. So everyone is very excited about that. And once again, we don't know how many people will show up at the first one, and we don't know how that will grow. So this has been a process of ebbing and flowing and changing as we need to see the changes. As Dale said, it was social emotional focused play group, and as an educator, I knew what to look for and what to do for the children coming in, and as I suspected, coming weekly, or even those that are coming just once a month, I'm seeing progress with these kiddos, with their sharing and with playing with other children and just being in an environment with other children and talking to adults, because we have grandparents and we have parents and we have sisters and brothers and a whole community that's meeting. Those were expected, and that's going to occur naturally. The unexpected things that have happened is the excitement from the community. I have had countless meetings with organizations in the area and people in the area that have asked to meet with me and said, what's going on? What are you seeing? How can I help? They just want to be involved in some way. And that's been very exciting. Even more exciting and unexpected, and just, I was thinking of the kids just as we all were, but the changes that I'm seeing in the adults that are coming into the play group and seeing, yes, we had COVID hit and these children were impacted and we are helping them, and these adults were impacted too, and the adults were not in a healthy place and we needed them to get to that healthy place to help their children. And that's something that I didn't have in the forefront of my mind until these adults started to present themselves. So I just wrote down, I have them stories, and they're very simple, but I can get shows that can be and what we're doing for the adults to have the adults help the children that they're living with. Also with a grandmother that comes, and with grandma and grandpa, and they bring their grandchildren. They start taking every single week and they were on time and stayed the whole time. We got to around November and they missed time, which I thought, well, that's interesting. Maybe something happened. Maybe they had their grandkids today. Things happen. And then they missed a second time. And then I started to get a little concerned. And then when they missed the third time, I was contacting this family. Come to find out, grandma ended up very sick and was in hospital. Well, we had other play group members who I wasn't saying they applied to play group, but they were asking because they also heard that this grandma and grandpa were missing. And they were asking, like, hey, what's going on with them? And so I got permission from the grandma to share with the play group that she'd been ill. She's doing better at home and I hope to be back. Well, she came back. Oh, I get a little emotional. She came back into the play group, and people that hadn't known her else in the play group hugged this woman when she came into the room. And that was just so exciting to see the connections that these adults are making. And they said hello to the children as well. And so they were concerned about not seeing those children also. The next one is also a grandma, and the grandma brings her granddaughter with her. And we do a group time. So most of what we do is free, and we insert ourselves as educators. The 3 team comes in and they help out, and I help out. We have another assistant teacher, Brianna, who speaks Spanish fluently. So we have Spanish families that come on a regular basis that she interacts with. So we had a group time, and I encouraged children to come over. These girls are small, they're birth to 3, and some of them already come to a group time, and that's okay. And I noticed this little girl was not coming over, and grandma had a look on her face that said that had disapproval, and she was disappointed. And I had seen this a few times throughout the morning of, oh, my grandchild not doing what she's supposed to be doing. And I noticed right away during group time that she really wanted her to come over, and it never happened. So between the end of group time and our departure, I made a point to go up to the grandma, and I said, I noticed your granddaughter watching, and she was listening, and she was engaged with what we were doing, even though she was on the other side of the room. And she's a very observant child. You must be very proud of her. And the next time they came to playgroup, there was a different interaction between this grandmother and this child. And ever since that interaction that we had, the grandmother seemed to be given permission to let her child be a child at playgroup. And now she talks up her grandchild and all the great things that her grandchild is doing, and they just have a beautiful relationship. The next family was amazing. It was a family that was right away by the parent that the child had anxiety and social anxiety and had never been around children. The pandemic was really tough for them, and they had anywhere else. And they came to playgroup late first name, and they hung out just in the entry area for a time. And it took them a long time to come into the room. And I was as encouraging as I could. They came back a few weeks later and tried them, and then they came back after getting a parent. I found out it wasn't that had anxiety; it's the parent that had anxiety about coming and was actually on medication for anxiety and a myriad of other issues going on. And now this parent is excited to come, engages, and actually gives me ideas of how we can do better here. And I take those ideas and use them, and they have found community. The last story is very simple, and I didn't know what was going on until a grandma walks into the room one Friday with a huge instrument box. And so I said, "Oh, Mary, what did you do for us today?" And she goes, "Oh no, this is for," and she mentions the parent name, and it's a big tuba coming out. Behind my back, they were talking about tuba playing, and the grandma plays tuba in all these bands, and struck a conversation with a stranger who's now a tuba, this parent, and said, I have extra tuba, would you want to play in the band? And the parent said, sure. So this grandmother brings in the tuba for this parent, and now they're playing the tuba band together. So I'm just tickled that we're seeing such successful children. We're seeing these parents that are getting healthier and really healthy community, healthy family in order to have healthy children. So that's what we're doing. There is no criteria. The Birth team heavily encourages their families to come because it's a good environment for the children that they serve. But this is open to community. Preschool, birth to preschool is what I tell families, yes, but no registration because that hinders people, especially those with anxiety about coming. And yeah, just young children is who we serve. Are there any other questions?
Are there any other questions for the Birth to 3 team? Seeing or hearing none.
There's a couple.
Oh, all right. It's hard for me to see. So will you?
That's how the Birth to 3 program is funded.
Not well enough. As I mentioned before, it's federally mandated, but very underfunded. We get a grant. It's around $100,000 and has been that for as long as I can remember. We do bill insurance for as much service as we can. Targeted case management can be billed through Medicaid or MA. The therapist, OT, and PT bill insurance. But this program has a caveat that's unique. Families can deny having their insurance billed. They can make that choice. So we have to offer them that opportunity to allow or not allow insurance billing. So insurance brings in some. We appreciate every dollar we can get, but not as much as we would like it to be. There is a fee component to Birth to 3 as well. That was waived during the pandemic, but it's being reinstalled in June 1st next week. That also is a small number of families that qualify or need to have an ability to pay a parental fee. So that brings in some, but not a lot. We get a small grant from the Knights of Columbus. It helps to fund some things that maybe don't quite right to purchase another with some additional things, and we are often looking for that. But a lot of it, we did just write another grant that we got $20,000 from the Mayo Hometown Grant, and we're going to put that towards extending the playgroup program. The initial grant that we got through the state ends at the end of September, so we are kind of scrambling to find different monies in the community to help that continue to keep it on board. And of course, a big chunk of the Birth to 3 program is funded by tax dollars, so we try to be responsible stewards with any other dollar that we can. That is the truth of where much of the funding comes from. So thank you.
Other questions?
I have a quick comment.
Go ahead, Supervisor Hagan.
Thank you. I have a couple of people in my life in other counties who have benefited from their Birth to 3 program. So I just wanted to take this time to say thank you so much for what you do in your limited capacity that you have. You've affected people and by also. Thank you.
Anything else? I have a question for. Is there any possibility of reauthorizing the playgroup grant? I know it expires at the end of the summer.
They didn't make that sound hopeful. We had with the state in February, I believe, midway grant we had to report in, and they truly encouraged us. They've been so cautious with the funding up to that point, and had probably 90% of the money left, if not more, and they just encouraged us to be creative and spend and use in your community how you think this will help children and families. So they did not give us any indication that they'll be for a renewal or anything like that. But I guess never say never. It's possible, but because it was related to the COVID funds, I'm not optimistic about that.
May I ask a quick follow-up on that too?
Yes, please, Supervisor Hagan.
Currently, what do you think for that playgroup grant funding are you spending like per month or so?
Oh boy, again, those first 6 months, we were so cautious. Probably the biggest expenses are first Rochelle's time and her helpers, the interpreter, and then she has someone assist with setup and cleanup. And then the other, probably the biggest is, the goal was to have some quick trip discounts, $10 a piece. People have to sign for them, but that has, we think, encouraged people to attend. And supplies, we did a Birth to 3 promotional thing. That event was last week. That well attended. The weather wasn't great. It was outside here. We had a really nice crowd. And that was a fairly big chunk of the money. The other Birth to 3 promotional bags with information. That we also got a hardcover book and a toy and some sensory things. So it was a little more than just marketing and snacks. And snacks, we have snack each week at the playgroup, so that's not a huge amount of money. We try to have a healthy snack for those young children and parents can enjoy.
I mean, what did someone say there are volunteership opportunities with the either the playgroup or the birthday program in general? Could you speak to that as well?
For sure, with the playgroup, if somebody is interested in attending regularly, we would run a background check. But if they're not looking for a payment, in fact, our OT, our occupational therapist, who worked with the program for many, many years, but retired 2 years ago, she attends every week help. So she is a volunteer, but very familiar with the birthday program. So yeah, we'd welcome that. Thank you.
So thank you so much for sharing everything that you're doing and for making this happen. Being that community is so valuable, and it's just really heartwarming to hear and exciting for the health party. So to follow up on some question about volunteers, also think how we can kind of the longevity of the playgroup. Certainly, there's a rehabilitation services major at Stout, so perhaps some of the students in the program or in early childhood education, there would be some opportunities to find additional volunteers. Certainly, don't take the place of the highly trained staff that you have, but maybe helping in some of those supporting roles as well. An opportunity to look into. Thank you.
Thank you, Joel.
A lot of meeting time. I just wanted to say Rochelle has been very resourceful in reaching out to community members and looking for places where maybe we can have field trips, and she's finding people want to get things for free often. We love, but we're trying to use up the grant money responsibly. But Pennsylvania is allowing us to use their outdoor play equipment for on summer days, so we can do some outside play groups and nice. So they're providing support in that area. The Play Space, which is the children's museum here in Menominee, is offering a much discounted rate for the Tuesday evening play groups that we're hoping to start next month. So just the support from the community at large has just been really wonderful to see and heartwarming all around. So a fun thing.
I got a question. When you were looking for grants, do you contact financial institutions like the Bremer Foundation, West Wisconsin, Rural Credit Union? Do you pursue that at all?
We haven't actively. I know Bremer has been good support in the community, but we haven't. But we should, I guess.
Well, I don't think they have about $125 million that they want to give away. And my experience with them, that's they've been more than generous to our village for the ballpark. Nice. 5,000 here, 10,000 here. I mean, and so that's over a period of 20 years. I don't know. I think they're always, if it's something that they think the government should be doing, they will do it. But I wouldn't be shy. It can't hurt, and it's a terrific program, and it's a program that it's not going to. So just a thought.
Some of the things we did try, of course, we can't buy ahead staff time, but we did try to buy supplies and things that will last a long time, so that if we can have funding to support Rochelle and her team, and then going in the physical items that we need for a playgroup. So tried to think ahead in that way, but yeah, we'll look.
Yeah, well, don't be shy. Be creative. When we roll our band, it looked like we had 5,000 kids coming there all the time.
All right. Thank you for you certainly are able to go if you're setting the food on the way. Thank you for being here and your presentation.
Yeah, and thank you very much for your work, which extends much beyond the playgroup, as wonderful as that is. Thank you for being here, and Gail, thank you for all of your work.
Well.
All right, take care, everyone. All right, moving to staff reports.
Can you hear me?
Yes, thank you, Greg.
Good evening, everyone. I'll start the report off with the memorandum format for that document for letterhead. And again, how I approach the report for the members here. I'll go over the both federal and then just the financial highlight. Locally, what I'd indicated is a couple future things that are no longer future, but in this report, they were still future. And one was just an outreach event, May 3rd down at UW Stout, partner with Veterans Health Administration, as well as the Lacrosse Veterans Center, which also is a program of the Veterans Administration to outreach veteran students. So we get a lot of the Stout staff that shows as well. And again, kind of maybe just to ensure that they're aware of the resources that are available to help support them in all the levels of the VA, as well as assisting with any of the state benefits. And then on the 18th, now it's already happened. There was a meeting at the St. Croix County Veterans staff in collaboration with the St. Croix County Service Officer and hopefully in Burnett County's service officers, as well as a number of veterans that had been in receipt of some of the benefits due to the newest legislation of the PACT Act. I think that was well received, and Senator Baldwin also is one of the authors of it's called the CDSO Act, which I provided some information on that. And I'm not sure if it's in committee with it hasn't been approved, but basically what that is supporting federal funding for counties and their veteran service offices, because I think numbers that she had highlighted that at the meeting. Well, I think roughly, don't hold my feet to the fire, but I think it was 70% later of all of the claims applications that go in are done by service officers and not done by the service officers. So good support for that. At the state level, there's an upcoming part of our state association's leadership, and we've got a block of time at the Wisconsin Counties Association meeting, which I think is down in Wisconsin Dells, 19th. So it's tight. I get to know your service officer. Every county has one. We'll have an opportunity for question and answer, and it's the Wisconsin County Associations is a very influential partner for a lot of our programs here at the level, and so it's good to be able to have a seat at the table, at least be recognized, and to talk about what we bring to the county and state as a whole. The federal benefits. There's been kind of an uptick of some billing issues that take up some digital time, take us away from doing direct claims assistance, and that is kind of an ongoing issue in addition to community care, where the federal VA will authorize a veteran to receive care at some of our local healthcare facilities, and then oftentimes there's some billing hang-ups with that, and so the veterans will bring it in. Sometimes it's just explaining to them what the difference between an explanation of benefits versus an actual invoice. But we have seen an uptick in issues related to that. Either outdated office submitting the billing directly to other health insurance, such as Medicare, rather than to the VA would authorize that. And I have the budget adjustment that I have did a build up over about 3 months now that it's coming. So it's here.
It's here.
Yeah, it's here. It's already deposited to finish and close the loop to be able to get that adjustment on the books so that we can start to spend it. So when we get to that part of tonight's meeting, then I'll go over that adjustment. Any questions regarding that part of my report? All right. The next thing I included in this month's packet a comparison of 2022 versus 2023. We call that survey report, and one of the changes we did last year, kind of to track things more longitudinally, we started tracking some of the retroactive payments, and I thought it'd be beneficial to start including a little bit of a comparison, so you can look at what these numbers look like, and you look at trends, or even to smart additional questions if you may have. But typically the comparisons do really marry up pretty consistent throughout, and this will be the first year, regardless of retroactive, so we'll be able to see if there's any uptick. I'm sure that there's trends based upon VA staff productivity throughout the year and completion of some of those claims. We'll keep an eye on that. For impact statements this month, I would just highlight a kind of news story to see again a veteran go from tough times, and if you kind of look at the dates from 2014 up through now 2022, so about 8 years to go from a really tough situation and weapons charges and community service and a number of those things all the way up to today with the home purchase. So that's a credit to the effort and even work with other in this county government, and do just highlighting a couple other organizations that this individual had very good interaction with, and help kind of led to things being accomplished with the home purchase and employment. Work ethic and hard work is never the issue. Just sometimes those impulsive decisions. However, the Arbor Place is a pretty influential organization in this young man's life, and developing and getting really following some of the program related, as well as ongoing AA. So that's a good credit to him and his family, and excited about home purchase, as well as cutting some wood to put in the outdoor wood boys. Happy about that. And then the other partnership with the Menominee Moose Lodge, where we had a number of people from the county, some employees that came in, and I got some chicken. It's pretty good chicken. Although I think there's a reason why some of the people that were manning the grills were out back behind the shop there working on things. I think apparently you can cook better if you're having a few beers, so they said. But it was a great part. That's the second time that they've really, I'd say, come to that sport organization. Last year was a breakfast that they did, and we go over here and help serve and clean up, since they're willing to do that for our office. Any questions about?
Yeah, Greg, your interaction on appeals and things filed with the VA, how is that? Is that about normal, or are you experiencing some difficulties?
So the difficulties when it comes to the Board of Appeals, it's a long delay. We've to get an in-person or a video conference hearing, 2 years to 4 years. And that's again based upon their vote, and they allegedly hired some veterans law judges, the titles of the individuals. But there's a couple things within the initial claims that we've seen that are just some glitches in. I believe they said they do some artificial intelligence generating form letters, and so we had a whole bunch of time spent on answering calls for veterans that received letters indicating that they filed a claim for not applicable. And so trying to address that. So those are the things that do create a little bit of a delay, and a number of reasons. It takes time out of our day to explain what this letter means or doesn't mean. But surprisingly, I can say it's consistent. I would expect it to really be more delays on the initial claim, just because of the PACT Act, which I give credit to the federal VA, because I think that they had a little bit more time in developing processes and procedures, because they knew that this was coming. And so it was a lot of delays and some major challenges. For the most part, I think things are still way faster than 10 years ago.
The new judges are that they're, you said like they're doing it. My question would be, is the learning curve for those new judges that come on, as far as understanding the in and outs and how they go?
There should not be. Those should be more seasoned, higher level VA employees with good experience and a belt to be in that division. However, there's a reason why there's a Court of Appeals of Veterans Claims, because that's where you take the decision that veterans law judge made that you disagree with. So there is still errors that are made. I've only encountered I've done quite a few. I've only encountered a few that I now know how to approach, versus that you never do a hearing on a Friday afternoon before holiday weekend, because the interest and effort is not there and you visually see it. But those are some of the ones. But that training's they're at such a higher level to begin with.
Thank you.
Any other questions?
Just had a quick, procedural question. So for number 2, where you're getting the $650, will that be as a budget adjustment coming up, or how does that get into your coffers?
If we need it, the budget, it'd be an adjustment through the year. Otherwise, we don't spend out our budget, because it goes for veterans. If it does, that's where we got carry over. And this year, if you look at our current budget, we had a $972 carry forward from last year that we didn't need. So quick answer, yes, but today, no. Okay, we can't spend it unless we do a budget adjustment. Yes. Any other questions before I move on to the financial part of the report?
Go ahead, Greg.
So for my educational purposes, I met with our CFO to again become better and more knowledgeable about this format versus the other format that we used for quite some time. And it was very, very helpful. She's an Excel wizard for sure. And so for our purposes, and really, unless there's any questions about 2021, 2022, just really focus on and highlight a couple columns, and we're looking at adopted budget versus the total adopted budget. If you look down through those columns, the only difference on our office budget is the budget adjustment that was done. That's when you have an updated budget, and it'll easily cross-check that when you look down through that. The actuals versus the projected. So that the projected, we as managers, directors can go in and update. I never touched any of those before, so you can. That's your column, and I don't touch anything if you're breaking an Excel document. But it was really, really helpful in going through that with her, and really kind of explaining the part. Just to reassure you all, I know the budget well. The format here in reading it is different. So nobody leaves going, how the heck can you manage a program if you don't know the budget? I know my budget. But if you look on the very first page, you'll see the far right column, total 2023 projected $24. So we look at that, and that projection gets filled from the other other parts of the document forward, and that's a result of me not going into just some of those projected, which I have the opportunity to do, because again, it showed up there more because in just one line item, we have a financial investment system, and we built it into pay for it in a contract line versus like an IT contract, and so one is budgeted, one does not have a budget, so it shows a negative, and would not have just projected health standards is not correct, and so nothing is at risk of being overspent. Matter of I only speak for myself is going in and doing updating and correcting those projected better to help correspond, but the real key is looking at what's remaining in that, and really doing that comparison, kind of those actuals and remaining. So that's just kind of my quick overview on this. But as it stands, we have an adequate amount of veterans relief left. My assessment is I anticipate that we'll be using more of that in comparison to 2022, 2021, because a lot of the money's kind of drying up or getting a little bit more restricted from some of our other partners because of the federal COVID money. But I could be wrong, but that's kind of what I'm projecting there. And with our CDSO, 11,000. No concerns regarding that. We'll be spending some of that to accreditation or continuing training. That'll show our department a bigger cost because of the financials.
So apologies are not necessary.
I should be about 6 months ahead of you on this, though.
Yeah. Okay. All right. We'll give you that.
No question. That'll be my brief. Oh, I didn't have it right. I will. Thanks, Chris. We actually received a donation from the solar energy project. Yes, yeah. How that in life everything happens because of relationships and timing, and they just have their hero and what the actually does so and they want their overall, and they want to be able to support and show good stewardship in the community. Just talking about relief efforts, I think they want to absolutely give that. I'm sure somewhere on Facebook there's probably a photo of us hanging on to a check together, and I'll share some of that. Press release as well, and I anticipate looking at opportunities as well.
That's great. Thank you for sharing.
Thanks for reminding me, Chris.
Is there any further questions regarding the statutory report? Let's move on to public health. Are you ready with us, Jeff?
Absolutely. Good evening. I want to first and foremost apologize for the volumes that I gave you. I did there's no quiz. I'll get the highlights, but in order, I would things that ways that actually. So I'm going to give you where they are in the packet. On pages, if you have any questions, you can just scroll through as you go. So the first thing you saw associated with the health department was that normal state of hygiene, respiratory. I think continue to see that our numbers are going the direction that we want to see them with respiratory illnesses, a little bit of an increase in viruses, but a lot of good things. The second in the packet was the 2 pages. I specifically tried to pull for you some of the client successes, trainings, things that are going on in the department. I think that is really helpful for you guys to know. I'm going to highlight a couple things for you guys. One, I want to share that with a discontinuation of health at the federal level, there have been some data recordings that's directly impacted our partners in long-term care facilities. They used to use as a metric that no longer exists. So they are using this gray area between CDC and the Centers for Medicare Care, so CMS, to make up their own policy on masking and other responsibilities. And so we're working with them to make sure they have the information that I have to inform decisions. So I'm sharing some of the early emergency room data, sharing some of the wastewater data a little bit before it's on Wisconsin DEGA's website, and some of the ILI illness, influenza illness data again, that's reported through our local partners to the state partners. And so there's a lot of conversation on how they can use it for people and other interventions. So that's one thing. We also did that we have a lot of training in the report, so from a variety of sources and free, which is also really helpful. So we participated in the Fierce Conversation trainings that Jen and Another and human resources put together, and that's really a conflict management training. I was really supportive for who maybe have because they were great as line staff and have to really think about how to manage people. So that was really helpful. Real colors was us. We got attention. They were in a very large room with horses. So it was the first kind of big group training we had done in literally 3 years, and so that was really positive. Being able to talk about how we have different approaches to things in English language. One that is not on there, we just finished up early, I think about that for a second, was working with Dr. Lainey Marshall from UW. She's also worked with thinking about individual values and our own personal experiences. So when you think about work that you do in life, you have better resilience in personally and professionally, and you're more apt to stay in that work. And so we'll connect that's for another couple of sessions. I know some knowledge work and to support her time. So I think it's really important for you guys to have some awareness around. The next thing in my report that I shared to make sure something like that really remember that's the time I told you guys during our time together. I shared that Wisconsin is typically representing local public health, and I said that we were in the bottom. So what we had in regard to sources that will back up that assertion that we are as well as our and some other counties, our states, go with the healthcare that's absolutely through the medical and that's the source. And secondly, through precision and that's lower. There's the data behind that assertion. I think that's time I can't spoken. And then lastly, I'm going to pull out Izzy had a basically acceleration. So our pull-up in high school with her master's degree. She started with us working part-time while she was going to school. That was COVID, pre-COVID, and during COVID, kind of slowed things down. So she's finally graduated. So in that, you have a picture of her diploma, which just warms my heart. And then you also have access to a high-level presentation related to her master's thesis. So she was able to have married both worlds and did some quantitative data associated with volunteer opportunities, specifically with Health Done Right. So what she put together in her recommendations was some low-hanging fruit associated with people to volunteer differently than they would have 10, 15 years ago. And so that's something that we need to integrate into the work that we do with Health Done Right, so we can give people opportunities to volunteer that meet their needs as well as our needs. So one and done volunteer opportunities, things that are family friendly. Not everybody has an opportunity to volunteer where it's just an individual function of high level qualities. And sometimes there are some opportunities that are family friendly. And then you heard that we need to increase outreach around the work that we do and the volunteer opportunities that we have. People don't know what we do. How much people public service other stuff is really and those opportunities is less well known. And so we're taking that to heart. So in addition to the two couple other things, one is lifting up in addition the revenue bill. So what you have is Assembly Bill 245 in its entirety, and I'm so sorry that that's 100 pages. Really all I needed to do was page 142 in packet 123 of the document itself, where it's talking about something that really doesn't have a lot to do with shared revenue, but there are some very strong themes. So is prohibiting local health officers to close business for more than 14 days due to medical disease. I will share with you that Assembly Bill 245 had some amendments and timelines to expand that timeline for dates and having the ability to have an extension after that. So a little bit just so you guys know what that's about. Typically, it takes a really long time to close business for medical disease. There are a couple of situations when you have prolonged outbreaks associated with a sick food worker. Think typhoid Mary, if you guys remember kind of Health 101. But maybe hepatitis or salmonella or something along those lines, but necessarily know and don't have dimensions to prevent ongoing transmission. It's unusual, really, really unusual.
like also here. The challenge is for continuation is that oftentimes these have very small numbers of employees, and it would be very hard to be HIPAA compliant and not maybe expose that business to undue scrutiny because of somebody having an illness. I also wanted to share just a little bit how it's maybe different from what we have done in the county. So specifically around the raises. So when there were limitations on the raises in money, that was a full board decision, and there were metrics around that. So based on cases and a couple other metrics that were agreed upon with the board, there was a number of participants and it was discussed at the twice, and the monthly monthly honestly while looking at that closely. So that was able to be done by the board because the county actually owns that property and it paid in the contract that health and safety. When the same conversation was had with the hockey station, we were at a place where we had no hospital beds. We literally had no hospital beds, and I was pushing for them to not have hockey. They jumped to contracts. We didn't post them. It wasn't a contract. And I'm grateful that I think. I just like to give some information about what that public health authority looks like, how it has not been used in the country for COVID, and that's our most recent. And how the large shared revenue have really good implications for locals. This little thing doesn't seem really to be in there, but with a 30-day kind of duration and another day extension, I don't know that would be hugely impactful to local businesses. So I wanted to share that from an educational standpoint. All right, so for that, we have a 2-pager on the state health improvement plan. So I wanted to pull out the state does community health assessment just like the local level. The state came out with a very different methodology, and they are really looking up social determinants of health, so things in society that impact wrongly, and work really far upstream to make sure that we prevent conditions that happen. And so that 2-pager things that I just want to really clearly. One is housing, and so when we are housing here, that aligns with the health, recognizing that a housing first model really does have a significant evidence-based and shortages and some impacts. Probably thinking about that, I think it's support health and long-term health outcomes. We have about 20 studies we do more recently. So I would use this evidence improvement. Another thing happening there, one thing I pointed out was early childhood and specifically high quality care. And when you look at health outcomes, a really tight window of opportunity in early childhood where you can affect positive change. And I was really happy to see that. And it's not just childcare, but some of our programs work that far upstream. When we look at nurse family card general for these families, you have 6 months on investment, and you know that critical time. So I wanted to look at that as well from the state plan. That is connected to the work we're doing at the health department because we're starting a community health assessment cycle. We have less. It's like a year of work on a tri-county community health assessment, the county and Clare County, where we get to the position to do the work and to create the survey, but then we'll have our own data plan and they'll be their own assessment on improvement. And so we think about these social health and the questions that is a 2-page survey instead of a 22-page survey. It's likely where it's facing me and have the time to do the survey. So that's a lot. We may see some more of those social determinants of health follow up in our own community health assessment. So I wanted to put that on your radar. And then finally, let's see, if you almost all the way on the packet and page 165 scroll through, I do have a budget adjustment, and we'll talk a little bit about that when we get there. And then the very last page, 280, are the financials. So that's my report, and we'll get to financials. If there are questions about what I shared with you in the packet.
Are there questions for Casey?
When you were well as also right, so we have a whole freedom. Right, so are these changing standards and or intent changes is whether being as the level. And then there's some objects and we actually look at our municipal orders that for key for the high for the levels and PMA is proposing that's really helpful. What's about thing is that it wasn't just a health impact study, it was going to be with the organization more, but some remediation was the dynamic so that's all understanding working at the state level and it's level for each customer. Thank you.
First statement under the packet that we have through the each specialist, I was able to attend one of those, and I think they did a great job when I was there. So I feel like something fantastic. Is there any crossover between that and the bill 245 section that you're looking at? They're probably completely separate things, but if a establishment is I guess well within their OSHA standards, does the bill offer any immunities to those? I'm asking.
So let me try to understand the question. So does the Senate Bill 245 take away the opportunity or need to host a retail license, retail food business? I don't know that it takes it away, but it definitely puts some parameters around it. So that's at 30 days in the Senate Bill. Opportunity still exists in the Senate Bill. So the parallel is going to go. So that parameter would be that you could close a business for up to 30 days if there was a community like they know what's going on. They know they have they know they have E. coli and they work and they co-work sick and they get participants and entities and they operate. But we did not do that. So we closed. I remember some 20 years. I had an outbreak at a local chain in another state, so this is not local. And we had something along these lines happen. And so we had weeks of continuous conversation. We put in safety measures we had done deeply, and then we had started commercial samples for their entire team. And that's really where some people didn't know that they were sick were still shedding water. That wasn't virus. That was actually people sick. It takes a lot for us to close a business like that due to communicable disease, and it really does hit a really high threshold of risk. Are we something people somebody that's PDQ willing about us? So I do think that the Senate Bill 235, Senate Bill 305 could impact process. I can't nursing now, I'm writing this. I can't really see how a communicable disease that we currently know would not drive solely a closure of business for 60 days. It just seems really, really high. Is that helpful?
Yeah, for sure. I think it was during the pandemic when everyone was having the 6 feet apart in establishments, and I'll literally ask if the EH specialist comes in for inspection and this is like, is there crossover between departments if that's like standards?
We did not intend to have local visible spacing or requirements. They were really guidelines, and so we would educate about safety hazards to event their patrons, but there wasn't an enforcement tool. There were other locations in the region in the state that did have local orders, and they were enforced oftentimes by the hospitals because they have business relationships with the owners of these establishments, and that's a significant chunk of it.
Yeah, that helped a lot.
Questions?
So what you have on page 2 of the packet is our finances. We are looking at this point 69,000 unspent, and we still have a lot of wiggle because we are looking at a small amount of data in the expense. You will see that that when we look at those projections, some of our expenses are a little bit higher than just directly, and it has to do with some of our large business, our revenue sources that we know are going to come in our costs. So we're doing that projection. So for example, some of our medical record systems that comes out in a large chunk, and also our licensed facilities pay items in end of June, early July, and so we know we're going to source there as well. Nothing is of concern, but I did want to share and I apologize for not kind of stuffing this in a more intentional way, that one of our grants, the public health ARPA grants, that's $5 for public health facilities, we receive those dollars and continue to carry them year to year for COVID response. Because we're seeing such a significant COVID cases, I'd like to shift that focus from, and this was in the scope of the grant response, to more of a recovery aspect. And so I'd like to acknowledge those dollars just on and we need to be good stewards of that within the scope of the grant. And I would like to bring that back to you guys to talk a little bit more about that next month. Any questions on the financial page that's in front of you?
Yes, Kirsty, is that a date certain we have to spend the money by?
Yes, thank you for that question. So with these dollars that we have to start by the 24. And so as we move 24 budget, I'm starting to have conversations sitting down with Director Winter and Assistant Director, I'm blanking on his name, sorry. Thank you so much. And we talked a little bit about because that's one of those places where we have an opportunity to really work upstream to prevent long-term health outcomes, because we see social emotional learning and well-being impact long-term success. Also, we have some of the infrastructure allowances that are there, and then how COVID really impacted the access to healthcare, so that's healthcare, and some of the other places where we have an opportunity to support children before. Does that help?
Yeah, it's very reasonable. Any idea on the amount? Do you have a guess?
So we do. So it's all dependent on our COVID cases. And my crystal ball, I've never been good at saying, what are our COVID cases going to look like. But we do think that we'll have some sort of staffing needs to contact tracing place and our vaccine and specifically impacted by COVID.
Thank you.
Any other questions on this board? Finances moving forward. Thank you very much. Excellent report. In one breath, we like the information. We like the information out there. All right, moving on to Human Services. Ms. Winter, are you ready for our staff report?
I am, and recognizing that my birth 3 team took a great majority of my time, so I don't want to keep you lengthy here tonight. I'll just mention that you have in the packet my director's report, and there's just an area that I wanted to lift up is the Recovery and Wellness Consortium, who received an award at the Wisconsin Children's Come First Advisory Committee, and this was their first award and conference, and they lifted up our team of 9 counties who worked really hard to work on developing wraparound principles for the cases we have in the families that we're working on. And really what wraparound principles are is ways that we work with families to look at the basic needs, their emotional needs, and really having in-depth conversations with people and talking about supports and how we can have supports people in the community, things like the play group to help people if their children are in that age, to be able to help them move forward with whatever's going on with their disability or issues, to bring them to RWC, which, as you're aware, mental health or substance abuse, depending on what's going on with them and their family. So we serve children and adults in that area. And so really it's a different model of working with people. It's spending time, it's really getting to know them and their needs. It's doing in-depth assessments. And what that means for us is we will have smaller caseloads to be able to do that, because you can't do that. So we're really looking at a different system, working with families and doing that well. And so with that, we were presented this award, and that's moving forward. There's a lot of training and continued work that will go into this and work with the case coaching. I want to lift them up because that was really neat. That Wisconsin, we were recognized for that. Also get an audit that we did very well with in the CST. And I know that just last week we also had our CSP, and that turned out very well as well. So great job that staff are doing, and that's being recognized here as well. I also want to share with you for next meeting, I will have the annual report ready for you, and that will be in the packet. So look forward to that. And I will be on vacation, so I will be participating virtually to give that report with you, but know that I won't be here in person. That's what I had for my report. Do you have any questions for me?
Any further questions for Ms. Winter?
Yeah.
I'm sorry, Supervisor Sheen, I couldn't hear that.
Well, as usual, it was just a smart remark. I said that because of that, you can't be here in person.
I doubt it. I doubt it. And it's always so nice to hear that it's being recognized for the really superb work that you all do. So that's great.
Yeah, thank you.
Good question.
I'm sorry, Supervisor Hagan?
Thank you. Under Department of Space Needs, is that something that you're going to wish list into the 2024 budget future, or can you scan that real quick?
Sure. I don't think that's a 2024 budget. We need to look how do we do that. And I haven't even had conversations, with Chris or facilities on is there space available here, any of those kinds of things. So I certainly want to put it in the budget until I know what other options are for us. I just want to be aware that when we moved in this building, my understanding was we had lots of space and had offices, or maybe 2 people in an office, and now we're looking at in some offices 4 or larger. So just with the changes of the growth in the department, that we're continuing to look at that.
Very good. Yeah, thanks for the heads up.
Yeah.
All right, Paul, finances?
Sure. So as Katie and Blake stated, this is projected when you're looking at your finances here. And in fact, there's an error at the top of this. I recognize tonight. I should say Human Services year to date 2023 and 2022 summary. Yeah. So we'll get that fixed for next month. But when looking at this, you'll see here that it's January through April. Again, to look at those expenses and what they're going to look like at the end of the year. We did the same thing. What I talked about is really those projections of what are one-time expenses, big expenses. Are they looking other expenses looking at the year and look at those projections. So it looks like we're to the good of 608,508. But again, that can change by next month, right? So I do have good news on one of the individuals that's been in Mendota for almost a year. It looks like we might be in the next month. We came out into a group home in the community, and so cross your fingers and we pray that works for the individual as well as our budget, because it would be good to get him at least restricting. So that will be very helpful.
Absolutely. Any further questions? All right, great report. Thank you very much, and thanks again to the B3 team. That was great. We have a little bit of business to conduct. The first review of the April DHS vouchers. Once again, that's because we're printing off. We seem to have trouble all of the bills on the same page, so it's lengthy. It's lengthy anyway. But the amount that we are reviewing is $354,808.70. Those are the DHS vouchers for April. I need a motion to review of those April vouchers. Is there a motion? Supervisor Stacy, is there a second?
I'll second.
Is that Mr. Lamb?
That was.
Hey, thank you, Mr. Lamb. Any additional discussion on the DHS vouchers?
Yeah, Mr.
Yes,
Speaker. I move that we approve the review. My only question is, there any outstanding or exceptional information that we should know, Paula?
No.
Any further questions on these? It's a lot to take in. All right, all of you are going to review DHS. They are reviewed, and we have 3 budget adjustments, one for each of our departments. First is Health.
Thank you. So this is a little budget adjustment, so this is $1,000, and I've shared the story behind this. So we had a company with diabetes, and so that's not an appropriate way to dispose of that, but that we highlighted the need for folks to dispose of their needles, since things with our own county own waste management, there isn't as clear a way to dispose of things. And so we were going to mention that they weren't able to, but there is a fund that was given description from the Olsons that will fund that little initiative to both get folks first injured so that they don't get injured, and dispose of them so that we know that the health and sanitation aren't injured as well. So I think that's a great opportunity to highlight the work that the community does, and that we were able to do that to help the community.
Thank you for the communication. Everybody's funds for allowing us to have. So we have a motion to approve this $1,000 budget adjustment for the Department of Public Health. I think I saw Supervisor Dean's hand up. That's a motion. Is there a second?
I'll second.
And I actually see you. That's all. Wait. Mr. Lamb seconds. Any further discussion? If not, all in favor, say aye.
Aye.
Any opposed? Public health budget passes. Second budget adjustment is for veteran services. We have been looking for this for a while. Greg, do you want to discuss this?
Yeah, the wait's over. So first thing I got on my report, I'm kind of ashamed to bring this up now. Please don't forget about Memorial Day on H. I apologize. Evergreen Cemetery here in Menominee, there'll be a ceremony there. Mr. James Ivins is going to be the speaker for that, and there's a whole number throughout our county. There county great representation and a lot of ceremonies. I apologize for that. That should have been the first thing on my report. So this is supplemental CVSO grant, part of there's budget that used some leftover COVID money to help support all of the county veteran service offices throughout the state, as well as the tribal veteran service offices. And this was our allotted amount. It goes through 2024. We are using this to add one additional 8-hour shift a week for a part-time individual who's there 1 day a week now. So we know this is coming. So if this approved, we will get the budget adjusted that way.
Excellent. I need a motion again to approve the, that's Supervisor Steen again. Yes. Supervisor Steen, is there a second? Supervisor Robinson, thank you for that. Any further discussion? Not all to approve the veteran service office budget, signify by saying aye. Aye. Any opposed? Veteran service office budget adjustment passes. And finally, yes, Supervisor Steen.
I have a question for veteran service officer. The solar contribution, how much was it?
I believe it was $550 if you compare. It was $550 sitting on my desk yet.
Thank you.
Yeah, thanks to Elk Creek Solar. All right, the last budget adjustment is for human services, and it's fairly lengthy, lots of grants. Ms. Winter, do you want to speak to this?
I'm going to go line by line. No, I'm teasing.
I don't think so.
The Mayo Clinic Health Grant is the one that the Birth to 3 team talked about this evening. It's that $1,000. The state opioid response and the GUAR grants with the Greater Wisconsin Area Agency. Oh, I forgot what the hours, but it's the aging program.
Aging program, yeah.
Yeah, it's the aging program dollars. And so we project what these grants are going to be, way back, starting in this time of year for the following year. And we received from the state, and one was a reduction, 113, and then GUAR was multiple in and outs to make those adjustments for what the actual grant was.
Again, self-explanatory. I motion to approve the budget adjustments for DHS.
A motion.
Thank you, Supervisor Hagan. Is there a second?
I'll second.
I'm sorry, who was that?
I'll read.
Hey, thank you very much for that second. Any discussion or any questions? If not, in favor of approving the DHS budget adjustment, say aye.
Aye.
Any opposed? That budget adjustment passes. And with Greg's announcement about the day observances, are there any additional or observations that members would like to make? If not, have a meaningful and satisfying Memorial Day weekend, and we will see all of each other on June 2nd. It is adjourned without objection.
Well, Madam Chairperson.
Yeah, thank you. Take care, everyone.